Thanks so much, Derek. And good afternoon, everybody. It's great to be with you. For those of you I haven't met who are maybe new this year to the conference, I'm Nicole Costura. I'm Assistant Director at the Ohio Lottery Commission. As you've heard, hopefully, from other sessions throughout this conference, the lottery stands proud to be a partner with the Ohio for Responsible Gambling Coalition. And while it's true, we're constitutionally mandated to provide funding for education in the state, we remain committed to encouraging responsible play and take our role in problem gambling prevention very seriously. You've heard about our trainings and the funding we provide, but in addition to our partnership with Ohio Department of Mental Health and Addiction Services and with PG&O and many others, our participation in the great statewide prevention campaign, Get Set Before You Bet, that Derek just mentioned. I hope you've also seen our lottery-specific campaign called Keep It Fun Ohio. This campaign aims to educate consumers on lottery games odds specifically, set limits, identify risk factors, and then connect individuals if they or a loved one might have a problem. And I do miss seeing you all in person, but I would be remiss if I didn't thank Corey and Mike and Derek and everybody at PG&O and the planning committee for putting this conference still on virtually during Problem Gambling Awareness Month. I always appreciate this time of year because we get to learn from each other. And I really do value the feedback that you all provide. And on a personal note, I've been in state government for about 12 years throughout different levels, the last 5 being at the lottery. But I've had the benefit of seeing the impact that many of your organizations have on our community. And I just wanted to say that I really appreciate the work you each do every day and, just appreciate the feedback that you guys share. So now it's my pleasure to introduce today's speaker, this afternoon's speaker, Amanda Conn Starner, who will lead us in a session called Ways to Build Prevention in the Faith Sector. Amanda is a certified health education specialist and Ohio certified prevention specialist and serves as senior director at Prevention First. She has a Bachelor of Arts degree in English Literature and Journalism certificate, along with a master's degree in health promotion education from the University of Cincinnati. She graduated from the Community Anti-Drug Coalition of America's National Coalition Academy and serves as an advisory council member for Ohio's statewide Prevention Coalition Association. And on a fun and personal note, and to check to make sure that you guys are still awake after lunch, she tells me that she loves Mediterranean food. So if you could type in the chat the best Mediterranean restaurant in your area, her and I both actually will make sure we check those out when everybody can travel again.
Right.
And with that, I will turn it over to Amanda and for her presentation. Thanks, everybody.
Thank you, Nicole. That's right. We were serious. We wanted to know where the best Mediterranean places. Oh, here they come. So I want really good tabbouleh recipes, very good tabbouleh recipes. So anyway, we just wanted to keep it a little bit lighthearted. And once we do start traveling, then we will definitely take note of these different awesome places, Mediterranean food. So thank you very much. I'm going to check with Nicole or Corey if you could. Oh, here we go. Let me share my screen. Just a second. I need to pull it up real quick. All right. I'm just transitioning to getting it to, okay. All right. All right, I'm going to start. There we go. All right. Nicole and Corey, does that look good on your end?
Yep, looks great.
Okay, thank you. Sorry about that. Okay, so as she mentioned, this is ways to build prevention with the faith sector, an overview. This is actually a training that we have done in the last couple of years. It initially was intended to be in person, but we have obviously expanded it to a virtual format. And I'll get into the history of why it was created, but we've been able to really reach the faith sector, which has been historically, with the coalitions that we work with, a hard sector to reach. So we're hoping that this particular information that we give you and the toolkit that is available to groups in Ohio and to other people outside of the state of Ohio to help you build that connection with building prevention in the faith sector. So let me see if that has moved. Okay. I want to make sure, Corey, are you seeing takeaways from today?
No, it hasn't advanced.
Okay. All right. I'm not quite sure why it's not. I'm sorry about that. There we go. Okay, are you seeing takeaways from today? Okay. So the takeaways from today are, we want you to understand how the toolkit came to be, because that gives a good reference point, and really who it is intended for and how to use it. You're going to receive a basic overview of prevention. You may already know a little bit of that, but it is part of the whole toolkit training, is to provide that at least basis of prevention skills. We're also going to talk about incorporating gambling prevention strategies in the faith sector, and then understand what the faith community can do for somebody, a family or an individual who is dealing with a substance use disorder or mental health condition. And for those who are not familiar with prevention, much of the work that we do carry out is rooted in the strategic prevention framework, which is also the acronym we call SPIF. So the work that is in this toolkit, and I'm going to hold it up right here. This is the toolkit that I'm going to be referring to, and I'll talk more about and where you can find this available, but it is a hardbound copy. We do not have this particular toolkit because of the copyright online, but we do have these available. So much of what this is covered in this toolkit is rooted in the SPIF evidence-based practice. Okay. So prevention first role, hopefully you're going to see that. Has it advanced to slide 3?
Not yet.
I think there's a major delay, so I will be sure to start earlier. Okay. Well. Okay. I'm just gonna, hopefully it will, if you don't see it in a few seconds, Corey, let me know. So prevention first role. So for those who may not know about our organization, we are a nonprofit. We've been around for 25 years. This is our 25th anniversary. We were started as a comprehensive effort to address youth substance abuse. Our mission is to promote healthy behaviors by sparking and sustaining community change. And our vision is that people make healthy choices in every stage of life. So 25 years ago, we were started after a constituent came to then U.S. Representative Rob Portman after a loss of a family member from marijuana and inhalant abuse. And that person, that particular parent said, you know, what are you doing to combat this? What is, you know, what are we doing to prevent this? And at the time, there really wasn't too much at the community level that covered how to address addiction and prevention. So this nonprofit was formed. We've gone through various different funding cycles, federal grants. We still have some of those. We started off as a drug-free communities grant, which is a lot of coalitions go for that grant. It's called the DFC. So since then, we have expanded our role to include behavioral health prevention, gambling prevention, as well as suicide prevention. So we've expanded as the field has expanded as well. So it is a regional behavioral prevention nonprofit agency that serves the greater Cincinnati area that makes up basically roughly the Cincinnati media market. We have, as of to date, we have 33 member coalitions that represent rural, suburban, and urban areas. And we provide year-round technical assistance and trainings to those particular coalitions to make sure that they sustain and sustain in a very even path and on a strong path. So I will go to the next slide.
And Amanda, what I'll do is I'll just share from my end. You just let me know when to advance.
Okay, do you want me to stop sharing then?
I can go ahead and just take over.
Okay. Sorry about that.
And I'll just go to
That one right there. Yeah. Thank you, Corey.
no problem.
Okay, so you'll see the snapshot of what I just presented right there, the toolkit. This actually was started more than 20 years ago. It first started as reviving the human spirit. And the reason it came to be is a number of faith leaders from a variety of denominations in the greater Cincinnati area, you know, they're working in with their congregations, and they realize, you know, we have a pretty good grasp or understanding of treatment and recovery and helping our congregations, but what are we doing to be proactive or work upstream with the issue? So they got together and they put together this particular toolkit. It is not a curriculum, it is rather a series of different steps and strategies that congregations can use to start to implement prevention in their congregation. So some of the founding partners included Interact for Health, which is a foundation down here in Greater Cincinnati. Another group is Faith Partners. They were instrumental in writing some of the founding content to this particular toolkit. The Minnesota Institute of Public Health, as well as the UMADOP of Cincinnati and the League of Ministries Consultants. So the UMADOP, there are several around the state. It is the Urban Minority Alcohol Drug Abuse Outreach Program. There's one in Cleveland, Columbus, Lima, Mansfield, and this particular one in Cincinnati helped us out with that. Next slide, please. So backing up a little bit, 2019 in April, we took a look at revamping, actually before that, we took a look at revamping the toolkit and rebranding it. Prior to the relaunch of the particular toolkit in April 2019, we probably spent about a good year or two with looking at the toolkit, seeing how we could put person first language in there, how we could be consistent with what the field is saying currently, and really making sure that it had a new look. It was current with what's going on here in the community in terms of resources for individuals who might be seeking treatment and recovery, as well as making sure that a lot of what is included in here is rooted in the science of addiction. So a lot of the content that you'll see in the back of this is from the National Institute of Drug Abuse. So we wanted to be mindful that there was a science behind what we're trying to present. And we wanted to eradicate any language in here that referenced addiction as a sin, because we were rooted in more of what NIDA was saying. Now, obviously that's up to each congregation if they want to go down a different path, but based on this toolkit, we went with what was consistent with NIDA. So in April 2019, we had a big community event, invited a variety of church members, current leaders, even one of the founders of our organization, which is Reverend Damon Lynch. He was one of our founders who created this 25 years ago. We actually had it at his church. And we did a formal relaunch, and we brought together a number of church leaders. We had focus groups. We wanted to get their feedback on the particular toolkit. So it was a good event. And from there, we launched into a variety of different trainings. And that's what we're doing today as well. So next slide, Corey. So presentations today. This is just a fraction of them. We've had a few come up just because as people hear about us, they want to know the training, to have the training done. And at this point, being virtual, we're able to do it very easily. And it's very accessible to people more so than ever before. But just some of the presentations we've done to give you an idea of who the audiences have been. We did a big one early on before 2019, we did one in the Dayton area around Montgomery, in the Montgomery County area, with a variety of clergy who wanted to get together and learn collectively about the toolkit. Then we did one with the an anniversary of the Reformation with the Lutheran and Catholic Summit here in Cincinnati. We've done one at the Greater New Hope Baptist Church in Avondale, the Prince of Peace Lutheran Church. Coalitions Rising is a Prevention Action Alliance conference that we did in 2019. We covered the tri-state area. For those who don't know, we go into Northern Kentucky, as well as our service areas in Northern Kentucky and in Southeastern Indiana. So it's not uncommon for us to go into Northern Kentucky or even further south to do training. So we've done some with the youth mental health providers that work in that area. We've done one with the Adamus Board in Summit County and Columbiana, and then even a behavioral health organization in Greene County. And then most recently, Fairfield Faith Leaders. There's this wonderful, wonderful neighborhood of faith leaders in Fairfield with different congregations, and they get together and they meet and they figure out how they can help each other and help their congregations. So if somebody's in need of something, it could be just basic food, housing, anything like that. It's a wonderful group. They interact with one another to help each other out. So they're helping people get the services and the basic needs that they need. So next slide, please, Corey. So going back to, and this is something that, so a lot of my experience here at Prevention First, I've been here 10 years. And I've been able to really grow and be trained succinctly and successfully in coalition development. So a lot of what we talk about today is going to be rooted as if you were going to start a prevention coalition in a church setting or in a synagogue or in a mosque. It's same principles that apply to building a coalition in a community apply to getting a congregation ready to accept prevention, be ready to accept it, be ready to implement it. So we're going to talk about readiness. So you got to consider, how ready is a congregation? What's going on in the congregation? Are there parents, youth that are coming to the pastors, coming into the senior clergy? Is there a lot of discussion around substance use disorder or concerns they have about marijuana use, alcohol, prescription drugs, gambling? What's resonating? What's going on with that particular group? And from there is when you can start gauging anecdotally, like what's happening and what is needed. What information do they crave that they need that is readily available through the partners that are on this particular conference, through Prevention First and other agencies. So you want to look at, first and foremost, just like if we were to go into a community, do you have the blessing of the clergy or faith leadership to even implement this? If there's just a few people who are really into it, are you wasting your time trying to build prevention if the senior leadership isn't going to accept it? Same thing if we were to go in a community, we want to make sure that the movers and shakers or the community leaders that make up like the police department, the fire department, the business leaders, the church, the school. If we were to go into a school, we'd ask for the blessing of the superintendent to see if we can go forward with implementing a particular prevention curriculum. Same type of thought process. You want to start with the higher up and make sure that they have the buy-in. And then also taking a look at the same time, since we are talking about gambling and gaming for this particular conference, how is that seen? Is the faith sector that you're particularly in, the particular religion, does it promote gambling and gaming? I know there's plenty of festivals down here in Greater Cincinnati where it is a no-brainer. They have it every time. And how is the interaction around youth? That's the big thing that you always want to ask yourself when you're dealing with prevention on any element, whether it's substances or gambling or gaming. How is that interaction? What community norm is being created in front of these youth? Are they going to think it's just a natural thing to always have gambling and gaming and to throw money away, or to be spending tons of time at a particular festival just gambling? That's what you want to look at, and you want to look at from the prevention lens when you go to want to start prevention in your congregation. Next slide, Corey. The other thing is, are you going to have just youth involved or adults involved? I think with gambling and gaming, it's probably going to be a mixture of both. That's always ideal. Then you want to determine who's going to make up a particular faith team or subcommittee within the church that is going to carry out the prevention that is needed. It's almost like a mini coalition or committee within the church sector. And this goes back to saying before, what I said before, has there been particular individuals in the congregation that have expressed a need or a want to address prevention or just help? They may not even know how to phrase it. Like they may not realize what they're wanting is prevention, but how are they expressing, oh my gosh, we're having major problems around this and that. And how is that being addressed? And that's where this prevention measures can be brought in. And it's very informative. It can be very information based. Just knowledge gained can be part of the readiness and getting them started. So next slide, Corey. So I just want to take a minute or so. I want to, if you are with a faith organization or if you want to work with one, what opportunities or resources currently exist within the faith sectors you're considering to build prevention? And then what are the programs or activities that already take place? Could gambling or gaming component be added? So I'll just take a minute to see what folks put in. Bingo, casinos, casino festivals. Definitely, those are. Does anyone have like a committee that they know of already in their faith sector that plans festivals for the church? That would be another good entry point to get prevention. And you could have somebody like PGNO or another organization that's rooted in prevention come talk to them about good community festival practices. There's a lot of good evidence-based practice around that. Confirmation classes with parents, absolutely. I'm actually going through that right now with one of my children. It's all virtual, but we're making it happen. We do a senior wellness program in churches. Somebody said gambling education could be expanded. Okay, very good, yes. Especially with that bingo and casinos, that age group. Okay, engaged in doing faith-based prevention in the African American church through Mary Haven, men's groups, absolutely. Okay, so those are all some very good ones to consider. Presenting to men's and women's groups, text studies, Bible studies, absolutely. While you're thinking of ideas, I will say, I mentioned in the previous slide, one of the churches we presented to early on is the Greater New Hope Baptist Church in Avondale, which for those who aren't familiar, that is a primarily African-American community, one of the oldest ones in Cincinnati. And they just took this toolkit and ran with it. They have a ton of different ministries within their church, and they decided we're going to have this toolkit live out through our family ministry. And through that, they're still doing prevention. They've actually got people starting to go through prevention credentialing, and they want to become a Ohio certified prevention specialist. So they've done that. They continue to build the information that they give to the community around prevention and different substances, gambling as well. So they've really been a model with carrying that out. People have said provide prevention services during the Reach and Teach program at church. Yes, absolutely. Ministries within the churches such as youth ministries, Bible studies, etc. Yep, absolutely. And we'll get into this a little bit, but there is a section on here that just focuses on Old and New Testament pieces that are scripture that have a prevention message that can be weaved into sermons or Bible studies. So that's all part of this as well. Okay. Thank you very much, everyone, for your feedback. We'll take another activity break a little bit later on. So Corey, next slide, please. Okay, so let's get into the elements of the actual toolkit. If you could go forward, Corey. So as I mentioned, there's a basic Prevention 101 overview. What a faith community can do for someone in trouble with a substance use disorder. Not only that, but how can you be proactive and help the individual, help the youth, help the families who are having to help somebody who does have substance use disorder. And as I mentioned earlier, we have a strategic prevention framework basic overview, and then how a faith sector can carry out prevention like a coalition. So next slide, Corey. So for those who don't know, prevention is both a movement and a discipline. So it is a field and is also a discipline. It is a credentialed field in the state of Ohio and other states as well. It is very much rooted in the public health model, which we'll get into in a minute. We also cover a lot of in here the risk and protective factors, individual and environmental factors. And the church or the faith sector is very much a protective factor. And what I found with doing these trainings is many of the churches don't realize that they are a protective factor, in the sense that if they saw the 40 developmental assets, they would see how much of a protective and positive influence they already are. And it's just enhancing that to talk about prevention and saying it as prevention. So we get in that same thing is called the 40 developmental assets, which for those who would like to know more about that, you want to look up the Search Institute. The Search Institute is a great resource for that. Free materials, free posters, free just good things to even post up on your refrigerator that are very positive in nature. And then this also includes supplemental resources, this particular toolkit around from the National Institute of Drug Abuse and SAMHSA as well. So the Substance Abuse Mental Health Services Administration. Corey, next slide. So what is prevention? It is it's delivered prior to the onset of a disorder. There is a universal prevention, which means that you can collectively talk to the masses about prevention, like Prevention 101, talking about behavioral health issues, underage alcohol use, problem gambling, prescription drug misuse and abuse, and other illicit drugs. So this is very much a general talking to the masses, universal prevention. Next slide. So then there's other target populations in prevention. As I mentioned, the universal element, then there's selective. So if somebody were identified at risk, children of individuals who have substance use disorders or mental health conditions, or even problem gambling in their family, they would be deemed as selective. So you'd want to tailor strategies more for that group. It wouldn't be as universal or generalized. It would get into more detail of honing in on their background. And then indicated. So this is individuals who've already been identified as experiencing a problem. They may have already been assessed, and maybe they're trying to, and they're trying to stop that path of addiction. So this would be an indicated population. Next slide, Corey. So this is the Institute of Medicine's continuum of care. This is kind of what we've called like a protractor half wheel. This gives you an idea of kind of where we are, prevention is on the spectrum. So the promotion element at the far left in the dark blue, that's very much universal and just promoting good health, good healthy choices, good behavior. And then prevention gets into more of the different three categories that I mentioned next. So where we stop in terms of the prevention field is right in the middle. that is where a diagnosis or an assessment would need to be done by a professional person who is experienced with either problem gambling or substance use disorder. That's when we flip over to the treatment side. And then that's where we would, if we were in that situation and somebody needed that, we would recommend particular providers around here where they could go and get a assessment or diagnosis. So that's where our work ends, is right in the middle. And then as you can see, the treatment and recovery goes down into case identification, treatment, compliance with long-term treatment, and full recovery. So that is the continuum of care. Corey, next slide, please. So as I mentioned, prevention is both a movement and a discipline. The goal really with prevention is to defer the onset of alcohol and other drug use. We want to increase the abstinence from AOD, eliminate high-risk use of AOD. And when I say AOD, I also couple in there with problem gambling as well. You also want to address environmental factors to decrease AOD use, and then it's proactive. It's going upstream from a problem that you see with somebody who's been diagnosed. It's a series of evidence-based programs and activities that you want to build, for example, resiliency skills or refusal skills, the 40 developmental assets. Those are all planned series to help build youth or adults' knowledge of prevention, so that by the time they get to a particular age of maybe wanting to do risky behavior, they have hopefully already had the information and skills in their brain to be able to make good positive choices. And I want to make note that this is from Allison Scherer, this particular content on the slide, from Wingspan Training. She is one of the prevention gurus in Ohio, and that was from one of her courses that she delivered. Yes, next slide, please, Corey. So prevention creates a healthy environment, not only for the individual in the home, but also at school, also in the community. Not having an environment where either substances or gambling is just so relevant and prevalent. That is also what makes up prevention, is creating a healthy environment so that you're not having these community norms consistently in the faces of youth. So for example, people younger than the legal age of 21 or tobacco usage know that it's unacceptable to use alcohol and tobacco. That adults of legal drinking age, we're not prohibitionists here. We are saying that we ask that ideally you want to follow low risk drinking guidelines to avoid a pattern of dependence or abuse down the road. And that people of all ages use prescription and over-the-counter drugs at the proper dosage and only for their intended purposes. And then obviously no one goes down the path of using illegal drugs. And next slide, Corey. So prevention is public health. So if you think of like what a public health department does or a public health campaign, it very much shows an agent, a host, and an environment, the triangle down there on the right. Agent would be substances, alcohol, marijuana, gambling, gaming. The host is the individual drinker or user of drugs or person who's gaming or gambling. And then the environment. What is the context of how they're doing all these different elements, their agents? How is that being played out, these three? So the three questions you want to ask yourself for the host is, who is likely to be affected by the problem? And for the agent, what causes the problem? And for the environment, where does the host live? Are you in a festival where gambling is thriving because nobody's really taking a proactive lens or prevention lens to this? What could be, if you look at things from a prevention lens more so, you'll be able to point out where things could be improved, especially for the context of the community norms that I mentioned, and cutting down on risk of exposure for youth and others to be exposed to particular not, I would say poor choices, using alcohol, marijuana, problem gambling, and those type of substances. Next slide, Corey. So risk and protective factors. So there are a variety of factors that either through the lens of prevention either show that youth, if they have more risk factors popping up in their lives versus protective factors, that is a red flag, and that's where you want to increase those protective factors. So for example, a church is a protective factor, or a faith sector. In some environments, organized sports might be a protective factor. Those type of things, peer and individual factors. Do they have a good relationship with not only their friends in a positive manner, but also a caring adult? Do they have the support that they need? This is all part of the 40 developmental assets as well. So, and everyone is exposed to both of these throughout their lives. So it's just a matter of balancing them and making sure that obviously more protective are showing up than the risk factors. Next slide, Corey. So there's a resiliency approach too. There's ways to use prevention, especially in a church setting, to build resiliency, giving them life skills around how they view poor influences that come into their lives. And to be able to teach that through some skill building will only add to when they get into young adulthood and have to start making choices on their own, how they can, oh, I guess somebody lost my camera. Oh. Okay. I'm gonna type to them real quick. I will keep trying. Not quite sure why that happened. Okay, no worries. We will keep going with the content. At least you can still hear me. And I will check it, Corey, from time to time, see if it comes back on because nothing's moved. Okay, next slide then, please. So the developmental assets, again, 40 developmental assets, you can find it at the Search Institute. There's external and internal ones, the external being the environment that they're in, a youth is in. Do they have support and boundaries and expectations, constructive use of time, making healthy choices on their own. And then internal, committing to learning, positive values, positive identity, and being socially aware of not only their home environment, their peers, but the community that they do live in. Next slide, please. Okay, so gambling prevention, I'm going to get into this a little bit. And a lot of this, like I'm going to talk about, PG&O can definitely help you with getting you connected with these particular elements that can be carried out in a faith sector. Let's see here. So signage, for example, going back to the festivals, the festival sample, the example that I gave, what is being said when somebody goes to a festival about gambling? Is there proper signage? Is there proper wristbands that are given to those who are going into the tents? Even having something as prevalent as particular gambling prevention 1-800 number signs that PG&O could provide you that are up, and not just up and hidden off, but are they visible? Are they highly visible so that people know fully that, oh, I see that sign, I'm going to take note of that. So that's one way to be able to start incorporating some gambling prevention in the faith sector. Same thing could be done when there's different bingo events or church casino nights, making sure that that prevention-based signage is a part of it. Additionally, there's a curriculum that PG&O has that can be incorporated into the faith sector that talks about problem gambling and gaming and ways to prevent that as well. We also have here at Prevention First a community festival toolkit that is available. I believe we have one for Kentucky as well, where it teaches, in the past we have trained servers and adults who are volunteering at festivals how to do proper prevention strategies when it comes to carding people, when it comes to good practices, making sure there's proper, I guess, a distinguished area just for either drinking or gambling, and making sure it's not crossing into where kids play. Beer gardens, as Derek mentioned, absolutely. The pole, tabs, tent, all that type of stuff we can provide that kind of training as well with this community festival toolkit. It's just a good way to teach people from a different lens. Again, it's just kind of telling people, hey, there is a whole discipline and field to this. Let's take a look at these events through a prevention lens. And ultimately, it's going to pay off with less problems, less, not only individually, but in the community as well. Smart Bet campaign, that is something that PG&O can connect you with. There's a full campaign here in Ohio around that, as well as financial literacy over gambling. Is that being taught in the faith sector? Is there a training instead of gambling? How about, are there classes for youth and adults over financial literacy and making sure that gambling and gaming is not a form of revenue for your household income? That can be a key element of some of the work that some of these groups do when they get together in the congregations. And then thinking of other ways to bring in revenue. I know everyone loves the go-to gambling or alcohol, it seems like, but have they ever thought of doing like a mocktails event where people come up with their own recipes for a mocktail, or different kind of events that aren't rooted in gaming and exposing kids to gambling? There's plenty of things. It's just people have to, again, look through a prevention lens and be creative and really think about what are you exposing the youth to. So again, gambling always about chance, not skill. And I think the more we preach that, then nobody wants to lose their shirt on a livelihood, or so being able to teach that in the gambling prevention that you might want to carry out with the faith sector. Next slide, Corey. So other evidence-based practice strategies that, again, PG&O can connect you with: stacked deck, smart bet, campus sense. That is a good one just for teaching kind of financial literacy with the college sector. And then risky business. And then a campaign that is out there as well right now is get set before you bet. So those are all ones that Corey or Derek could connect you with. Okay, next slide, please. Okay, so what can the faith community do for somebody in dealing with substance use disorder, mental health condition? And again, I'm going to say with this problem gambling. So when I say that, I also mean problem gambling as well, because that's all in that discipline. Next slide, please. So the faith community, as we may know, if we look at faith community as a protective factor, people go to the faith community they want to have strength when they come out of there. They're going there to have a source of trust and strength. So it's an ideal place to want to reach a number of generations and reach a captive audience. Mm-hmm. And you're going to be able to, on a weekly, if not more than once a week basis, instill deep, lasting changes with how to do prevention and utilizing that sector as best as you can. So it's just a great, I have to say, one of the reasons why we came up with this toolkit was the coalitions that we have, and this is not just here in Ohio or in the tri-state, but throughout the United States, there's some 5,000 coalitions. And one of the biggest sectors that people find hard to connect with is the faith sector. Faith, business, parents are some of the top 3 sectors that people have a hard time connecting with as a coalition. And so this is just a way to make that connection, bridge it a little bit better, and give you some tools. Like I said before, it's not a curriculum, it's just a way to cherry pick through different tools within this toolkit to be able to start that dialogue and start the prevention strategies. So next slide, please. So the faith community can accept the person who is struggling with a substance use disorder or problem gambling disorder without judgment, and really providing resources in the sense of connecting them without judgment, developing relationships with individuals who are struggling with the disorder so that they are not alone, having support groups. The church has done a great job of being a place where people can go to Narcotics Anonymous meetings, the AA model, the Gambling Anonymous, all of those. It's already a great place to have that trust discussion and talk about a disorder. So just continuing that with gambling as well. So again, prevention can be taught, or addiction can be taught through sermons or Bible study, confirmation classes, faith leadership meetings. And even, I'll add to this, if somebody's going through premarital counseling that's required for marriage in the church, this might be an element too, where you talk about problem gambling. What is it? What is addiction? And a lot, just making that awareness so that it is discussed and there is awareness around it. Next slide, Corey. So again, in faith community, given the dynamic of the populations that they have there, the age, the diversity, it can be a great place to information disseminate, different referrals, information that they didn't know about addiction or problem gambling, and host support groups, as I mentioned earlier. There's also Celebrate Recovery is also a good group that's come through the church setting. But keeping in mind, you can also do one as well with gambling. And then there's ones for family members like Alateen or Al-Anon. Next slide. So going into the strategic prevention framework, again, this is an evidence-based practice program that all the coalitions abide by or try to abide by, not just here in the tri-state, but if you're connected with the Community Anti-Drug Coalitions of America, there's about 5,000 of them. This is what is taught because it's evidence-based and it can be applied for years to come. So next slide, please, Corey. So here it is. It's called also a flower. We call it a flower a little bit. It starts with assessment. So before you start delving into wanting to tackle a problem, you want to be able to assess it and see what's going on before you start wasting any time or energy on something that may not be correct in what you're going for. So getting basically testing the waters in terms of what is the problem that you're seeing in the particular congregation. And this might be something as simple as like a SurveyMonkey survey or a paper survey. You know, what topics would that particular congregation want to know about, or what are the problems that people are seeing? And to make it anonymous, you know, SurveyMonkey probably would be best to make it anonymous. And then also, you can also look at other data sources. In terms of gambling, I would assume that PG&O might be able to help you with like trying to track down county level gambling issues or data that they might have. So that could be part of looking at it from the lens of what is the issue that's impacting that particular community. So from there you move into, okay, you kind of, you know what the problem is just from the data. Then you're going to go into capacity building. So capacity means, thank you very much. Can you go back one more, Corey? Thank you. Thank you. I just want to make sure everyone saw that. So assessment really is about understanding that population's needs. You need to know that before you can go on, really move on to the next step. So you want to be able to review the resources that are required and available. So that's what leads us into capacity. So next slide, please, Corey. So capacity, this is where we're talking mobilizing people, skills, financial resources, training. Maybe you have certain agencies that you know you're going to go to provide training on a particular issue. You want to just start lining up who's going to be carrying out the work. And that's where the capacity phase comes in. Because you know your problem now. Now you're going to line up your team, or basically your team, to start addressing the particular problem. So that leads us into the next slide. So planning. So you've lined up the issue, you've lined up the people. Now how are you going to execute it? So that's where you come up with an action plan. It doesn't necessarily have to be a full-blown strategic plan. I think that kind of scares people, and especially if you're talking to clergy, they're busy, they have a lot on their plate. You want to make it as simple as possible. So maybe you just say, I'd like to, you'd like to prevention team that maybe you form at the church. You want to just have an action plan that you can start talking about. Okay, what are the different policies that we could start looking at from the prevention lens? What programs and practices could we start looking at that would help this congregation on a better path? So that involves setting some goals. It could be 3 objectives. If you're familiar with SMART goals, that would also work as an objective as well. If you're familiar with how to write those. And then, working with PGNO or other prevention agencies, you could start picking different strategies and it doesn't have to be a lot. Maybe you just start simple. You want to do, let's start with 3 strategies we want to try and carry out in the next year or 2 years. And then see how that's going to meet the needs of what you addressed in the data collection that you came about through the assessment phase. So if that works for your team and it's going well, then you can go into logic modeling, and that gets into it a little bit deeper. That gives the root cause of a problem. That gives why are the conditions in this particular neighborhood causing or forming that root problem, or is gambling rampant? Is there no ramifications for this? That all gets back to the environment and the local conditions. So if the church is ready to do that, that's a deeper level. But I mean, if you're just wanting to start simple, just doing an action plan with goals, objectives, and strategies would be a good starting point. Okay, so next slide, please. So you've got the data, you've got the people and the resources, you've got a action plan. Now you have to start to implement. So that's where you start going over the plan and looking at, okay, what barriers are we going to have? Are there people in the church that are going to maybe come at it from a, hey, this doesn't make money for us? Or, how are you going to interact with those? And having some strategies attached to combating potential barriers. You want to be able, and maybe that's where the action plan just starts off small and then just builds that prevention as you go on and just gets people warmed up to it and understanding it. And then maybe you launch into more significant policy changes or practices. So this would giving more timelines and set projects. So this is all part of the implementation. Next slide, please. Okay, so then evaluation. If you get to the implementation phase, you want to be able to say, what we're doing, is it working? So that's where the evaluation comes in. You want to know if you're doing it well, and not only that, say you are doing it well, what else could you improve on? That still has to, you just always want to be learning and always want to be able to continue to improve a particular program or practice. So you can do pre and post surveys of maybe a community festival. Did people find it more enjoyable? If they attended a community festival that had better community festival practices applied to an event, just getting the feedback and the feel from the congregation of certain programs or policies that you've put into place. And then that can serve as a evaluation as well. Next slide, Corey. And then two overarching items of the SPIF that are something you always want to consider when you're doing community level work, even if it is with the faith sector, is sustainability. Do you have the pieces in place that are going to sustain this beyond just a year or two? You know, you want to be able to instill prevention long-term into our congregation. So even without funding, you can still do that. So it's sharing results with people so they know, hey, this is working. And look, we're still, you know, maybe we're still getting money in and we're still doing well, but look, we're putting through, we're using prevention measures in a positive way and it's working. So showing and sharing the results is key to the congregation and to the community. And maybe if a church gets to the point where they're doing so well, maybe they can train other people of other faiths or within their own denomination to do the same. So it can have a trickle effect with that. And then just cultural competence and or cultural humility. Those are kind of the two phrases that are used around this particular topic, making sure that what you're doing, are you culturally competent of who makes up your particular congregation. That could be demographics, that could be socioeconomic status, the nature of the particular community. Each community is a little bit different. Addiction's universal, but each community is a little bit different. Is the program that you're trying to carry out mindful of what is representative of the faith sector that you're working with? Next slide, please. Okay, so there's 7 proven strategies for community change. And again, this is through the Community Anti-Drug Coalitions of America. I encourage you to take a look at that. They will show you the coalition model and how there's so many different coalitions doing great work around the country. But these are 7 proven strategies that I'm going to go through that we use with our coalitions and that can be used also in the faith sector to carry out problem gambling awareness, or substance use prevention. So the first one is providing information, workshops, webinars, billboards. That is one-way or two-way educational or informational sharing. A lot of how you start doing prevention in the church could be this for maybe a while until people get warmed up for it or to it. This is the first step. And then there's enhancing skills. So maybe you want to train this skill set of members in the congregation to achieve that better population community change. For example, the community festival training would be an example of enhancing skills. Maybe teaching them problem gambling awareness or any of those other programs that I mentioned earlier that PGNO has available. That can be a simple enhancing skills and getting people to understand what you're trying to do with increasing prevention in the church. And then providing support, alternative activities to AOD use or gambling or gaming. What else can be done? People just need to think outside the box sometimes and be creative with what else can be done. Maybe not always defaulting to that tried and true community festival that maybe just has a ton of gambling or and causing problems in the community and with individuals in their congregation. You know, thinking outside the box and coming up with creative ways to do something else. So next slide. So then the 4th and 5th ones are enhancing and reducing the barriers. Just making this comes down to really making being mindful of the audience, who you're trying to reach to learn about prevention, or, is everything conducive for them being able to hear the message, and is it getting to their phones? Is it getting on their website, getting to a website that they can access? Is it, if you are having trainings, maybe is their childcare going to be available for those meetings at the church? All those type of things. You just want to make sure this comes down to just making it as easy as possible for people to learn the prevention that you want to teach them. And then changing consequences. And this is like, at least in the community level, this is increasing public recognition for good actions. For example, we've had coalitions in this area. One that comes to mind is in Fairfield in Butler County, where they publicly recognize certain businesses with a nice little plaque that would go in their in the business's window for being good prevention stewards and advocates in the community. So that's an example of promoting good actions. And changing consequences too can go on the flip side, where maybe increasing fines and citations for gambling that kind of trickles out into the street beyond a festival, that type of thing. Making sure that people are aware of the community that they're in when they're doing gambling and beer gardens and that type of thing, that there is a community focus, and they need to be aware that beyond that beer garden tent, things happen beyond that aren't always conducive for a neighborhood. So I will give an example on this changing consequences. We had two coalitions in the same year, about 7 years ago, do a social host law, and the state has one already, but you are able to strengthen your local one even further. And they did that because they were having issues with parents providing alcohol and to underage kids that were not their kids. And the particular law director, mayor, and police chiefs in these two communities wanted to change that. They wanted to increase the fines and make it a stricter penalty beyond the state law. And that's what they did. They did that, they made the change, and they started cracking down even harder. But that was a example of changing the consequences to cut down on the problem. So next slide, please. And then physical design. This goes back to kind of what I was talking about earlier with the signage, especially with the problem gambling. Is there signage showing people the alternative to what they're doing? Is there an awareness of, there's a get set before you bet type signage that you could put there? Or is there a problem gambling helpline that's provided? That type of signage, making aware, being mindful of the physical design of the environment, and providing a prevention message in there would be an example of number 6. And then modifying, changing policies. This kind of goes back to what I said about the social host law, but then there's also things like procedures, workplace initiatives. This could come down to, March Madness, problem gambling with the brackets and basketball. So that could be something too, that if you're working with workplaces or you'd like to change something in your workplace around that, this would be an example of number 7, is making that happen. Next slide, Corey. Okay, so this kind of just recaps a little bit the assessment with the strategic prevention framework, which we mentioned that earlier. Corey, if you want to go to the next one. So questions to answer. What is the gambling issue, the substance use misuse, or mental health issue that you want to focus on? Who is the affected population? Where is the problem occurring? Why is it happening? Why is it happening here? That would be in the assessment phase. And again, if you were to do a full logic model, these would be all the questions that you would be filling in and plugging into a logic model. But you don't have to go that deep of a route just to get an action plan going in a faith church, or into a faith sector. So these are just questions you want to be mindful of when you're starting prevention. Okay, next slide. The readiness, so this can entail doing interviews. It could just be something over coffee, like maybe you just have a cup of coffee with a couple of people or one-on-one, and you try to get their buy-in for what you want to do with the church sector and prevention. You might want to conduct focus groups, and this is where you're going to find out a little bit more. What are the problems that adults are facing or the youth are facing around gambling exposure or substance use disorders or mental health conditions? This is where you're going to be able to get some more detail anecdotally and qualitatively around what's happening in that congregation. And then surveys are always good, especially now with a lot of things being virtual. Doing it over SurveyMonkey, you really can get a lot of information. And then a congregational inventory is in this particular toolkit. And that kind of goes over who would be a good leader to, or who would be a good resource to do different things related to prevention. It kind of is like a checklist of who could help you out. So next slide. The readiness, this is all kind of just kind of a recap of what we were saying earlier, or what I was saying earlier, is it gauges support for you and the church leadership, and it really sets the tone of prevention ministry as you start making inroads into the congregation with it, and then provides input and surveys that can be built upon in the faith organization. And that you just get more, you get more buy-in if you understand the readiness. Okay, and then next slide, please. So a couple of ideas to carry out prevention on a very basic level. Sample sermons. This particular toolkit has different scriptures that are rooted in prevention that you could launch a whole sermon off of, or a series. Youth ministries. Then there's also substance use prevention for youth and families, minimizing high-risk drinking. This is really key too. NIDA, going back to NIDA, they have great free materials, free and very well done materials about youth brain development and helping individuals and families impacted by AOD abuse or problem gambling. The brain development pieces are just really well done and are very easy to digest at any level. And then something as simple as putting it in the church newsletter, bulletin, or social media content. Maybe there's every prevention once a week or once a month. There's some prevention content that's pushed out on the particular church sector's social media page. Just something as simple as that gets people talking. So next slide, please. So closing thoughts. I just want to take a moment to, let's see how we're doing on time. What is one action item, or maybe more than one, that you will implement over the next few months that you think could work? And I do want to make sure that whatever you may say, I mean, Corey and Derek may have more information to give you on the problem gambling areas. And I apologize, my camera is still not working. Yes, very good, Sharon. Reaching out to your pastor, and again, if you need that pastor to talk to us, we can do that as well, or talk to Derek or Corey, just talking about prevention. Just so I think people don't realize there's so many agencies and groups that are really focused on that. So to be able to connect us to them and help you out in what you want to do, we're here for you. The other thing is check on posters and brochures, absolutely. And there's a lot of really well done stuff on, as I mentioned, NIDA, Search Institute. I'm sure there's some other groups that Derek and Corey can provide too on the problem gambling. Yeah, I like the survey pastors on perceptions of gambling and problem gambling. I love the group that promotes healthy growth, healthy choices, healthy growth. Talking to the community about prevention programs for youth. Excellent. Yes. I think what it comes down to, people just need to realize, hey, there's a different lens that you can look through on most things like that. And so they just need support to carry it out. And I think that's where you who have an interest in it and us as agency members that can help you. Oh, this is great. Clergy certification level for gambling counseling. That's great. Awareness billboards, yes, very much so. I'd also like to get, I'll throw this question out as well. I'd like to hear from people, how many have gambling at their church? If you want to put that in the chat. Bingo, yep. I'll give an example that my kids go to a church-based school, and they had a community festival a couple years ago, and I know I saw kids under 13 at that one of the craps tables, and it was not a good thing. I ended up complaining to the school about it. Yes, oh my God, kiddie casino. Oh my God, no. Fundraising, every fundraiser, yep. Absolutely.
Well, thank you so much, Amanda, for providing this information. We're going to jump to a poll question now to verify attendance before I pass it over to my colleague, Mike Bazzelli, for some question and answer. I'm going to go ahead and stop sharing my screen just to be able to launch this poll question. So let's go ahead and that's launched already. So I'm going to go ahead and drop that into the chat as well, just for those who are unable to engage with the poll question via the actual poll. And so that is now in the chat as well. So feel free to engage either through Zoom polling or through the chat box. And again, I'm going to leave the poll open for a few minutes, but I can pass it on to Mike Bazzelli to facilitate some questions and answers.
Sure, we have about 10 minutes. Thank you very much, Amanda, for that information. I think some of my first questions and thoughts, I'm going to kind of relate it, if that's okay, to some of the work I do around colleges. I think it's relatable because a congregation of a faith community is its own community. It has its own community, it has its own culture, and that's very similar to a college or university. Not every college and university is the same. So, just saying, what works at Kent State will work at Ohio State, that's not necessarily true. They have their own communities, their own cultures. So I think that's really, mirroring what's going on with the faith community as well. So I was curious if you could talk a little bit more about what I really liked. Towards the end, you mentioned sustainability, and again, with college program, and I think it's really important to not just have some sort of one-off program, but creating something that's sustainable. And I think sustainability is something that I always try to strive for, because that's what builds trust. And I would imagine, I haven't done a lot of work with the faith-based community, so this was great to hear more about it. Building trust is going to be so important, because building trust is then what enables you to build more buy-in and have a program become sustainable. So could you just add a little bit more, I think, about the importance of sustainability and kind of not just rolling in and saying, hey, this is what you should know about problem gambling, and then leaving, but leaving some sort of foundation for further information, further programming, et cetera.
Mhm. Yes, thank you. I think that's a great point. I think in terms of a lot of the work we do, these are truly grassroots coalitions. So a lot of these people start off this group with just a passion and desire to see change done at the community level. So if they get funding, great. If they get stronger capacity and infrastructure, but you can still have a coalition that operates on a zero budget, and we have plenty of that. It's a matter of really having good infrastructure around how do you carry out an action plan, or if you go deeper into a logic model, so that everyone is consistently assigned different tasks. I have seen where coalitions, it's too personality driven, and then it kind of falls apart because it is so personality driven. Like if that person were to go away, then the whole thing isn't going to work, and you don't want that. So that's a sustainability element that we talk to them about, is that making sure that everyone has buy-in for what you're doing and that they're sharing the responsibilities. It really has to be a team effort. And maybe not everyone enjoys a particular thing around carrying out prevention. So just be aware of their skill sets. We've done surveys where coalition members have been surveyed. What is your best skill set that you could bring to the table and provide free time? So are they good at grant writing? Are they good at building relationships? Are they good at doing a case for a business proposal, a case study to a particular business to get a partnership, that type of thing. So I think in terms of sustainability, it's just a matter of making sure, however you start building, or when you start building the team of prevention at the church level or even at the college level, making sure that there's that capacity building, that everyone is assigned an area that they have an interest in or have a good strong skill set. And then if it's always important too that they have a mission and a vision. I think that's important too for any group that you start, even if it's just say you have a prevention group or team at a church level, so that everyone is always on the same page, a mission and a vision for what they do, and creating it as if you were a small, really you're thinking small, like you're a small nonprofit, in terms of what is your mission, what is your vision, who do you want to reach, and making sure the responsibilities are evenly distributed, and that you're following the same goals with your action plan. And again, ideally, it would be great to do a logic model, but I understand if that might be too overwhelming for some groups. But it is a beautiful thing. It's like a roadmap, a blueprint for carrying out community change. So I hope that answers your question. I know at the college level, I think I haven't even thought that far deep into that, but I think there's a lot of potential just off the top of my head. I mean, just connecting with the local college to talk about financial literacy over gambling to the church would be a great thing. If you have a business college in the community, we're fortunate down here where we have a couple of major universities, and I haven't thought about that, but like if we could reach out to like the business school at UC and could teach financial literacy around March Madness time or that type of thing, so that people get more into that mindset of, hey, this is really the way you should go and not the other way. So I hope that answers what you're thinking.
Yeah, well, that's a great segue. I mean, there's so many ways to talk about, whether you want to approach it as problem gambling or responsible gaming or gambling awareness. There's so many ways to put it into other things that people find important. So whether it's like just general decision making with youth groups, or if it's financial literacy with college students and business students specifically, there's so many ways to kind of get it in there and start to create some buy-in. And you mentioned leadership interviews and focus groups. Again, just I'm relating this to my work, but then have you elaborate more in the faith community. When I was doing a lot of college work, we did leadership interviews with student leaders. We did focus groups with students on campus to learn what their perceptions of gambling were, what they thought issues were. So can you talk a little bit more about that? I mean, are the coalitions doing like, leader interviews with faith leaders or focus groups with more just general congregation members, and if they are, kind of what information they're getting out of that, because I think that is a really great place to start to find out what are the behaviors, what are the perceptions around this topic and other topics, including, alcohol, drugs, mental health, inside that community.
Yes, absolutely. So we have it's a very short template of what we call a key leader interview. So whether it would be in the faith sector or not, we would use this interview set of questions what it gauges is, who is that person in the community? What role do they play? They may not even live there, but maybe they only work there, but they have a working knowledge of what they see and hear happen in that particular environment. We get an understanding of what prevention they see, either organized or not in the community, and what resources could be brought in there. So from there, we gauge also what connections can they give us. So a lot of these key leader interviews lead to other connections that we can start building the coalition. So we'll say, so do you have a couple other names of people who you think might be interested in this topic? 9 times out of 10, they give us like 2 or 3 names. And then that just starts the ball rolling, where we do more interviews that way. And that way they all start connecting. And then eventually what we'll do is bring all those people together that we did a key leader interview with, and we'll have our first meeting to determine, hey, do you want to go forward as a coalition? Is this something you'd like to do? And usually by that point in the process, we've talked about it, they've had an interest, we understand their interest, and then we will go forward with starting to build a coalition. We start saying, okay, well, let's start talking about a name for your group. Let's talk about a mission, a vision. What is the data? We start delving into the data. Who can get us data? And then you just start seeing this great community involvement where people are like, oh, I have data. I can get you data for this. I can get you for that. And then we start building really a logic model and start working through, and it's just amazing, the grassroots involvement. So I think that's where the key leader interviews, those can easily be modified from a problem gaming or a gambling lens, and in a college setting as well. So if that's something, if anyone's interested in, I'm happy to take a stab at giving you the key leader interviews from that lens, or you can take the ones I have and modify it as you may see fit for your group. But it's just a starting point to get that conversation going. And generally the interview only lasts about a half hour, 45 minutes tops. But most time, like I said, most people they have an engagement after the interview, and they're ready to get involved.
Yeah, great. Thank you. Well, and that leaves us at a good point. I mean, I think it's just about our field in general, whether it's the gambling field or the prevention field in general. People are always willing to share. So to any of the attendees, please feel free to reach out to PGNO for more information and those types of resources, but also Amanda as well.